Okay, in this video, we'll be doing checking the infant's Apgar score. So what you want to do, you want to gather all your supplies. You want to identify the patient. You want to provide comfort and safety. You want to make sure you do infection control, and you want to identify the patient. Also, you want to down your gloves. And when you're checking for the Apgar score, you're going to do 5 different areas. So the first area is the heart rate. So with your stethoscope, you want to check the baby's heart rate, and you want to check for 1 full minute when you're doing that. And you want to do these checks within the first minute of the child's life. Okay, so when doing the scoring, it's 0 through 2. 0 is when you don't have no heart rate. 1 is when you have a heart rate that's lower than 100 beats per minute. And 2 is if you have a heart rate that is greater than 100 beats per minute. Okay, so the next thing you're gonna look at is the respiratory rate. So you're gonna be looking at the infant's breathing and the infant's crying. 0 is if you there's no respiratory effort, no crying. 1 is slow or weak cry, and 2 is a normal respiratory effort. Okay, so the third thing you're going to be looking at is muscle tone, and you're going to be checking, basically the baby's reflexes and how the baby flicks. And 0 is flaccid, like if the baby is limp. 1 is if you have like weak muscle tone, not really flexing that much. Not really flexing that much. And 2 is if they have good flexion, good motor skills, and things like that. So then I did heart rate, I did breathing, I did muscle tone. The fourth one is reflex irritability. Okay, so you're going to check the baby's response to different stimuli. No response will be 0. 1 would be like the baby like grimace, make a face or whatever, and 2 would be the baby, if the baby cry. That's 4. And then the last one is color. You want to check the baby's color. You want to check the extremities. You want to check the mouth and the eyes. 0 is if the baby is pale and the baby is cyanotic, meaning the baby, a lot of areas of the baby is blue. 1 is if the baby have some pallor and some cyanotic areas at the extremities, the mouth or the eyes. And 2 is if the baby is fully pink. Okay, so once we have completed that's the completion of the Apgar score. You want to down your gloves, you want to do your hand hygiene, and then you want to document all of your findings and your score that you receive. And that completes the video for your Apgar score.